Cardiac arrest. Cardiac arrest happens when your heart stops beating, or beats so fast that it stops pumping blood. During cardiac arrest, people typically collapse and become unresponsive. Symptoms start without warning. This is why people also call it sudden cardiac arrest. This life-threatening condition can become fatal if you don't get immediate treatment. During cardiac arrest, your heart isn't pumping blood anymore. Within minutes, this puts your organs and whole body at risk of death because they must constantly receive oxygen. Your blood delivers that oxygen. Emergency treatment includes cardiopulmonary resuscitation and defibrillation. CPR keeps enough oxygen in your lungs and gets it to your brain until an electric shock restores a normal heart rhythm. CPR and defibrillators may save your life. Cardiac arrest symptoms may include loss of consciousness, heart palpitations, dizziness, lightheadedness, weakness. Sudden cardiac arrest happens without preceding symptoms. What happens right before cardiac arrest? Before you faint, you may have other signs of cardiac arrest, including chest pain, nausea and vomiting, shortness of breath. What causes cardiac arrest? Abnormal heart rhythms cause most sudden cardiac arrests. The most common life-threatening arrhythmia is ventricular fibrillation. This is an erratic, disorganized firing of impulses from your heart's ventricles. When this happens, your heart can't pump blood. When your heart isn't beating, there's no way to get oxygen-rich blood to the rest of your body. Conditions and situations that can lead to these abnormal heart rhythms are the underlying causes of sudden cardiac arrest. These include cardiomyopathy, drugs for other medical conditions, heart attack, heart failure, recreational drugs like cocaine, Brugada syndrome, long QT syndrome, severe illness or injury with major blood loss. Other cardiac arrest causes include coronary artery disease, congenital heart conditions, changes to your heart structure because of disease or infection, extreme physical activity or blood loss, infectious diseases, respiratory conditions, severe injury, toxins. You can treat and reverse sudden cardiac arrest, but cardiac arrest treatment has to start immediately, wherever you are. Survival can be as high as 90% if treatment starts within the first minutes after sudden cardiac arrest. The rate drops by about 10% each minute longer. Sudden cardiac arrest can be fatal if it lasts longer than 8 minutes. Without CPR, brain damage can happen after just 5 minutes. If you see someone experiencing sudden cardiac arrest, do this. 1. Call EMS immediately. 2. Start CPR, even if it's just the hands-only version. CPR can save a life by using chest compressions to replace the heart's pumping action. It keeps blood and oxygen circulating until help arrives. 3. Use an AED. CPR plus defibrillation rescues a person from sudden cardiac arrest. Using an AED is the best chance of helping a person survive. The shorter the time until defibrillation, the greater the chance of survival. To prevent future episodes of sudden cardiac arrest, to do these tests to figure out what caused your cardiac event. Tests may include electrocardiogram, cardiovascular MRI, blood tests to check electrolytes that play a role in your heart's electrical conduction, ambulatory monitoring, echocardiogram, cardiac catheterization, electrophysiology study. Treatments that can prevent cardiac arrest or lower your risk of a second episode include implantable cardioverter, a defibrillator, other arrhythmia treatments in susceptible people, medicines like beta blockers, fixing heart artery blockages with either coronary artery bypass surgery or angioplasty by Joshi Joseph.